Hi, my name is Katerina and I'm going to be demonstrating blood transfusion. So the first thing I'm going to do is look over my physician's order. So we have the patient Jerry Attrick, the FIN 261-824-375. He's 52 years old. The order is for today now, and it's calling for packed red blood cells 1 unit over 2 hours. It's been signed by the physician, so I know that I have an order for this transfusion, so I no longer need the order. I'm also going to look for the consent for the transfusion. So I can see here we have the patient. It's been signed by the patient and the physician, and it was signed today, so it's still valid. So I know I have consent to give the transfusion. Now I'm going to begin my first check between the record of transfusion and the patient demographic sheet. I would have a second nurse with me doing all of my checks to confirm all the information is correct. So we have the patient, first name Jerry, J-E-R-R-Y, last name Attrique, A-T-R-I-Q-U-E, and that matches. We have the FIN 261-824-375, and that matches. So that's my first check. I no longer need my demographic sheet, so I'll put it to the side. Now I'm going to do my second check with my nurse. So she is going to be looking at the tag while I still look at the record of transfusion. So we have the patient, first name Jerry, J-E-R-R-Y, last name Attrick, A-T-R-I-Q-U-E, and that matches. The FIN number is 261-824-375, and that matches as well. The patient blood group is AB positive, and that matches. The component blood group is AB positive, and that matches. I know AB positive blood and AB positive blood are both compatible with one another, so I know it's safe to give. The donation number is C0510-08-900-445, Y in a box, and that matches. So that's my second check there. So I no longer need my record of transfusion. I'm now going to look at the blood bag. I'm going to note that it's not expired and that there's no abnormalities with the blood bag at all. So then I'm going to begin my check between the blood tag and the blood bag, again with my second nurse who's going to confirm everything. So now we have that the component type is AB positive, which matches. The component type is red blood cells, and that matches. And the donation number is C0510-08-900-445, Y in a box, and that matches. I'm also just gonna note that it's still not expired, the crossmatch doesn't expire, and the blood is not expired. So once I'm done that, I can do hand hygiene and start to get ready to go into the patient's room. So I'm going to need the blood, a 250 ml bag of normal saline to prime with. It's not expired and the bag's intact, so I can use it. I'll need alcohol swabs, a flush, gloves, and tubing. So I can go into the patient's room now, so I'll knock on the door and do my entrance safety check. I'm going to notice that there is a primed normal saline emergency line ready in case of transfusion reaction. So there's no, so it's primed already and ready for me to use. So hi, my name's Katerina. I'm going to be your student nurse today. I'm just going to check your wristband before we get started. And I'm also going to do my third check at this time, or my next check at this time. So we have the patient, J-E-R-R-Y, last name Attrick, A-T-R-I-Q-U-E, and that matches. The wristband, the FIN number is 261-824-375, and that matches the wristband. Jerry, can you spell your first and last name for me? And he does. And can you tell me your birthday? And he does, and it matches his wristband. Do you have any allergies? He says no. Okay, great. So thank you to my second nurse. She can leave now because I've done all of my checks. So now I can do a little bit of patient education. So Jerry, today we have a transfusion of red blood cells. I know you talked about this with the physician earlier, but your hemoglobin was low, so we need to get those numbers up, and that's why he's ordered the transfusion. Some side effects of this transfusion that you might experience are a transfusion reaction, so itchiness, hives, trouble breathing, and feeling unwell. If you're feeling unwell at all, please let me know. I'm going to be staying with you for the first 15 minutes to see that everything goes smoothly. And then I'm also going to be taking your vital signs quite a lot through this process. So I'll be taking them right now for a baseline. I'll take them after the first 15 minutes for every hour that the transfusion is running, at the end of the transfusion, and 1 hour post-transfusion. Would you still like to have this red blood cell transfusion? He says yes. Okay, great. So I'll do hand hygiene again. And I can start preparing my tubing. So I have blood tubing here. I'll just take it out of the package. Then I'm just going to make sure both my clamps are closed. And that they're closed all the way down the line. And my roller clamp is closed. Okay. So I'm first going to prime my normal saline. So I've already checked the bag, it's not expired and it's intact. So I'll just aseptically connect. So just make it sure that it's spiked, and then I can hang it up. So now I'm going to prime my tubing. So my other clamp is closed over here. I'm just going to open this clamp all the way.
This would be our final label for
my roller clamp.
and this will just be the label for.
So I'm going to squeeze the top of the chamber, not the bottom, because I don't want to damage the filter. So I'll just squeeze it until the filter is completely covered. We want the filter covered so that the red blood cells don't get destroyed.
Compare them again with the PDM, with the label, the syringe, the medication vial, and the bag.
Okay, so my filter is completely covered now. So now I'm going to prime the rest of my tubing. I'm just going to make sure this clamp is open.
And then we have the preparation.
So I'm just going to follow it all the way down the line, and I can see it dripping out the end. I'm just going to visually check to make sure that there's no bubbles on my line, and I'm happy with that. So I'm just going to close my clamp, and now I'll put this to the side here, and I'm ready to spike my blood. So I'm going to do hand hygiene again, put on clean gloves since I'll be handling bodily fluids. Okay, so now I'm going to aseptically connect my bag. So I'll take off the blue cap here. And spike the blood bag. So I just want to make sure that my clamp is closed on my normal saline before I flip this one over, and it is. So then I can hang my blood. Okay.
So 100 units per ml, which is equivalent to 1.
So now I'm going to open my clamp to my blood and begin to prime this tubing. My normal saline is clamped at this point, so I'm just going to wait for this to prime. I'm just going to squish the bag a little bit to encourage priming, and then open my clamp here at the end. So now we're just going to wait until the tubing is primed completely to the tip. We want it close to the tip so that the blood hits the patient's vein as soon as I start the transfusion, so I can monitor for transfusion reaction. So I'm just following it down the line.
And I'll be using 1 ml of 100 units per ml.
And I can see it's reaching the end, so I'm going to close my roller clamp. Great. So I'm just going to make sure my blood's open, my normal saline is closed, and now I'm ready to put the tubing and the pump. So I'm just gonna hit primary. I'm gonna have the rate at 50 milliliters an hour. And then after the first 15 minutes, if everything goes well and there's no transfusion reaction, I'm gonna change the rate to 197 mLs an hour. The volume to be infused, I'm just gonna double check the bag here. And it says 358, so we'll put 358. And then we are going to change mode and label the line. So we're going to label it to red blood cell. So it's right there, so I'll hit select. So now I have my pump set up appropriately, and now I'm going to insert my tubing. So I'll click open. Insert the tubing. Okay. Great. So now that my pump is set up, I'm happy with it. I can start to connect my tubing to my patient. Okay, Jerry, I'm just going to connect the tubing now. So I'm going to first flush my patient's IV site. So I'll get an alcohol swab. Swab the port for 30 seconds. Let it dry for 15 seconds. And then I'm going to attach a flush. So making sure that it's primed and that there's no bubbles. And I'm going to flush my tubing. So I'll just unclamp, flush for a few cc's. Are you having any pain? He says no, there's no signs of swelling. So that's good. So I know that my IV site is patent. So now I can connect my blood tubing aseptically. So it's connected there. My clamp is undone, and I'm just going to make sure that all my clamps are undone down the line. So my clamp is open for my normal saline, and it's closed. Open for my blood and closed for my normal saline. So now I can hit confirm primary. We're all good here, so now I can press start. So now it's going to run. I'm going to wait for 3 drips in my drip chamber to make sure that it's running. I'm also going to be waiting with my patient for the first 15 minutes. I've already talked about the vital signs, so I'll be doing that as well. Okay, Jerry, I'm done setting up your transfusion. So I'm going to wait with you for the next 15 minutes and just monitor your vital signs and your overall condition. After I'm done that, I can clean up my bedside, take off my gloves.
Take my bag.
Oh,
Okay, good. So now
it says we have downstream occlusion. So I'll have to make sure that all my clamps are open here.
they'll be giving you your medication.
Which they are. There we go. So it's really important that I check all my clamps to make sure that it's open so that the blood will infuse. And then after I'm done that, I can document in the cumulative blood record that I started the transfusion, and me and my second nurse will sign that.
Tell you what I'm doing here.